Now I request Dr. Jayanti P, our quiz mistress, to carry on with the PG quiz competition. Dr. Jayanti, over to you.
Thank you, Dr. Sharlin. So we'll be starting with the quiz competition for the postgraduates now, the final round. We had totally 6 teams that participated in the preliminary run, and out of the scores they got, we have selected 5 teams. So I'll first introduce the teams to you. Team A, the first team, Team A will be GDC Kottayam. The participants are Dr. Manjusha and Dr. Krishna Priya. Team B, the second team will be from GDC Trivandrum. The participants are Dr. Ambili and Dr. Delna. Team C, we have from PSM Dental College, Dr. Sharifa and Dr. Monica Roy. Team D will be from Chettinad Dental College, Chennai. We have 2 participants, Dr. Pramika and Dr. Samyukta. And the last team, Team E, will be again from GDC Trivandrum. And the participants are Dr. Bimal and Dr. Lakshmi. So we'll be starting with the first round. So the first round is histology round. We are back to the basics. So we'll start from the basics. So this round carries 10 points if you give the right answer. There is pass allowed for only 1 team. So if the person answers correctly in the second chance, then they'll get 5 marks. So I think I'm clear. We have 10 marks for the right answer, and only 1 pass will be allowed to the next team, and that person will get 5 marks if they tell the right answer. So we'll move on to the rounds. So first question goes to Team A, GDC Kottayam. Please be ready. Your question is, identify the tissues that you see in this picture and name the cell that is marked in black arrow. You have 15 seconds to give the answer. Running out of time.
Mitotic figure, ma'am.
You have to answer both the questions. Question number 1 is, identify the tissues that you see in the picture. Name the cell.
Melanocytes.
Yes. So the second part is right. What about the first part of the question? What are the tissues that you see here?
Stratified squamous epithelium.
Yeah, very simple. And you also see an underlying fibrous connective tissue. Yes or no? So yes. So the answer is right. So participants, please keep in your mind, you have only 15 seconds. So you have to tell the answers quickly. So we have 10 points for Team A. That is, the tissue that you see is a stratified squamous epithelium. And the cells marked here are clear cells present in the basal layer of epithelium that are nothing but the melanocytes. We will move on to the second question for Team B. Team B, GDC Trivandrum, Ambili and Delna. Identify the tissues that you see in the picture. Name the structure that is marked in black asterisk sign.
Dental pulp.
Dental pulp is the answer to first question or second question?
First question.
So do you see only dental pulp here?
Dental pulp.
It's not clear. It's not clear. Voice is breaking.
Longitudinal section of the HN is the section of the tooth.
Yeah, what tissues are you seeing there? That is what is the question. I'm not asking the type of section. What are the different types of tissues that you see here?
tissue and soft tissue for elemental dentin and dental plasma.
Yes, exactly. So it is a decalcified section of tooth where you see both dentin and pulp, and the structure marked in black asterisk is the dental pulp. Yes, so kindly answer both the questions in the same order, number 1 and number 2. First give the answer for number 1 and then for number 2. All the other teams, kindly make a note of it. Give the answer clearly. So we have again 10 points for GDC Trivandrum. We will move to the next question. Team C, PSM Dental College, Monica and Dr. Sharifa. Very simple. Identify the tissue shown in the picture. Name the cell that is marked in the black arrow.
Salivary gland.
Yeah, you have to be a little bit more specific. Yes, salivary gland. Which part of
salivary glands?
Okay.
Name the cell. Myoepithelial cells.
Very good. You're right. So team C, PSM gets 10 points. This is the H&E stain section of actually a mixed salivary gland, predominantly mucus. And we have the cells that are marked there are myoepithelial cells. Team D, Chettinad Dental College. Identify the type of section shown in the picture. Name the structures that are marked by black arrow. Read the question carefully. Identify the type of section that you see here and name the structure marked in black arrow. Yes, go ahead and tell the answer. You're running out of time.
Cross-section of dentin.
Yes. So it's a cross section of a tooth or dentin, and the structure marked is peritubular dentin. Very good. Again, team D gets 10 points. The last question of round 1 is for team E. Again, GDC Trivandrum, Dr. Bimal and Lakshmi. Identify the tissue that you see here. Name the structures marked in black arrow. Dr. Lakshmi and Dr. Bimal. Are you there? Yes. Yeah. Loudly. It's a skin is the tissue, yes. And the structure marked in black arrow is?
Hair follicle.
No, I didn't hear you.
Hair follicle.
What? Hair follicle? No, the answer is wrong. You only get 5 points because you are also exceeded the time limit. So I cannot give you one more chance. The first part of the answer is correct. It is a H&E section of a skin tissue, but the structures marked as sweat glands. They are not hair follicles. Hair follicles are these structures where my arrow is pointing. This is actually eccrine glands, which are nothing but sweat glands seen in the dermis of the skin. So you have 5 points, team E. So at the end of round 1, team A, B, C, and D, all of them have got full 10 points. And team E has got only 5 points because they answered only half of the question. Now we will move on to round 2, microbiology. There is no pass in this round. It's a one-word answer. You have to fill in the blanks and give the right answer. There are 3 parts of the question. Each carries 5 marks. So totally you will have 15 points for every right answer. Okay, 15 points. You have again 15 seconds for answering this. Team A. Agent responsible for mad cow disease. Agent causing cat scratch disease. Vincent's infection is caused by. So you have to give answer for all the 3 questions. Each carries 5 marks. So totally 15 marks. Team A.
Vincent's infection is caused by Fusobacterium and spirochetes.
Name the spirochete. You have to be specific, please.
Aurelia Vincendi.
Yes. Number 1 and number 2.
Scratch disease is caused by.
Come on, you're running out of time. Fast.
Bottinelia.
Then mad cow disease.
Bottinelia hensleyi cause cat scratch.
Okay, mad cow disease.
Don't know.
Okay, so they have given 2 right answers. Agent causing cat scratch disease is Bartonella hensleyi. Vincent's infection is very simple. It's caused by Borrelia vincenti and Fusobacterium. The first part of the question, mad cow disease, is caused by prions. It's an example for a prion disease. Okay. It is also called as bovine spongiform encephalopathy. That's the other name for mad cow disease, and that is a neurodegenerative disorder, and that is caused by prions. So team A has only 10 points because they didn't answer question number 1. So we will move on to next team, team B. Again, very simple. Pathways related to activation of complement system are, there are 3 pathways for the activation of complement system. What are they? Name the pathways. Yes. Not clear. Your voice is not clear, please. Ambili and Delna, are you there?
Yes, ma'am. Classical and canonical pathway. Classical pathway, and canonical pathway.
Third one is?
One more.
One more. Another 5 seconds I'll give you. No. Okay. You have only answered 2. Again, 2 questions. 2 number 1 and 2, classical pathway and alternate pathway. And the third one is lectin pathway.
Lectin.
Yeah, lectin pathway. So again, team B has got only 10 points. We will move to team C. Granulomatous inflammation is seen in. You have to give one example for each of this: bacterial infection, fungal infection, parasitic infection. Team C.
Bacterial infection. Bacterial infection is tuberculosis.
Yes, right.
Fungal infection.
Yes, quickly.
Parasitic infection.
Fungal and parasitic infection. Only one example. I need only one example. Another 2 more seconds I'll give you. No, your time is up. It's a very straightforward question, so I cannot give more time. I'm sorry about that. So bacterial infection, you're right. Tuberculosis. Fungal infection, you have so many: histoplasmosis, blastomycosis, cryptococcosis. You should only tell one. And parasitic infection is schistosomiasis. That's an answer for parasitic infection. So you have given only one right answer. So team C, PSM Dental College, is getting only 5 points. Next, team D. Congenital infection is seen in. Give one example for each: bacterial infection, viral infection, parasitic infection. Bacteria is?
Syphilis.
Okay, syphilis, right? Virus? Virus is what?
HIV.
HIV. Yeah, HIV, right? Parasite? Another 3 seconds.
Toxoplasma.
Yeah, toxoplasmosis, you're right. So congenital infection is seen in so many bacterial and viral infection. I had to ask only one example. So they have given all the 3 right answers. Parasite example is Toxoplasma gondii. Virus is HIV, rubella, herpes simplex virus, cytomegalovirus. All these are known to cause congenital infection in newborns. And bacteria, of course, we have the spirochete. Syphilis, we have congenital syphilis. So team D, Chettinad gets full points, 15 points. We'll move on to the last question for team E. Epstein-Barr virus causes, name 1 neoplasm, 1 white lesion, and 1 lymphadenopathy. Bimal and Lakshmi, the question is for you.
Ksomp lymphoma.
Yes, right answer. White lesion and lymphadenopathy. Come on, it's very simple. Think of all the diseases.
Lymphadenopathy is infectious.
I can't hear you. Lymphadenopathy, infectious mononucleosis. Yes, you are right. What about the white lesion? Your time is up, Bimal. Your time is up. So the answer is oral hairy leukoplakia. Yes, it's very simple. Okay. So again, team E, GDC Trivandrum has answered 2 questions rightly. The neoplasm caused by Epstein-Barr virus is Burkitt's lymphoma, and lymphadenopathy is nothing but your infectious mononucleosis, also known as glandular fever. It causes lymphadenopathy along with fever, and white lesion is oral hairy leukoplakia. So again, team E, GDC Trivandrum gets only 10 points. Fine. So shall we move on to round 3? So round 3 is forensic odontology. Again, it's a fill in the blanks type of question. Every right answer, you will score 10 points. There is no pass here. So first question to team A. The accessory cusp that is present on the mandibular first molar is called as 10 seconds. 7, 8, 9, 10. Your time is up. The answer is protostylid. Yeah, your time is up. See, this is a very straightforward question. I'm giving you only 10 seconds. So the answer is protostylid. They didn't answer it in the right time, so they do not get any point. Team A. Next question, all the teams be very vigilant. You have only 10 seconds. You just have to give the answer immediately. Team B. Dash gene is used for sex determination in forensic odontology. Yes, AMELX gene, very good. They scored 10 points. Team B, the answer is AMEL gene. The AMEL gene is present on both X and Y chromosomes, so that can be used for sex determination in forensic odontology. Team C, which among the 6 variables in Gustafson's index contributes best to age determination in the adults?
Dentin translucency.
Dentin translucency, excellent. Team C again gets full 10 points. Team D, the material of choice for taking impression of bite marks. The material of choice for taking impression of bite marks is? Specifically, you have to tell. No, wrong answer. Polysiloxane is the right answer. So you don't get any point there. Then team E, the last question, when all the teeth are of the same shape, then the dentition is called as?
Homodont.
Very good. Excellent. Homodont. So you have 2 types of dentition, homodont and heterodont. When all the teeth are of same shape, like in some fishes and vertebrates, you call it homodont. But like in mammals and human beings, if you have different shaped teeth, then you call that dentition as heterodont. Very good. So team E also scores full 10 points. So at the end of 3 rounds, we have team A having 20 points. Team B has 30 points. Team C, PSM Dental College has 25 points. Again, Team D, Chettinad College also has 25 points. And Team E, GDC Trivandrum is also 25. So GDC Trivandrum with Dr. Ambili and Delna are leading at the end of round 3. Okay, so we'll move on to the next round, round 4. Picture-based questions. So I'll show you a picture. You have to identify that and answer the questions that are written on the screen. Each right answer will carry 10 marks again. Pass is allowed for one team and that will be 5 marks. So we'll start with team A. Identify the histological stain that you see here. Name the structure that is stained in red color. GDC got it.
Congo red.
Right? What is the structure stained in red color?
Collagen.
I am surprised that you're giving an answer like this. If you have identified the type of stain, then what will the structure that will stain red color in Congo red? I'm sorry, I cannot give the marks for you. The structure stained in red color is amyloid. We all know that amyloid special stain is Congo red. Yes. So I can give you only 5 points for this because you have only answered one part of the question. The type of stain is Congo red and the structure stained in red color is actually amyloid. Okay, now next question for team B. Name the structure that is marked in black arrow. Name another stain that shows these structures as black color.
The arrow structure is 100 hyphen and another stain is Grocot's methylamine silver.
Yeah, Grocott methylamine silver stain is correct. What was the first answer you gave me? I didn't hear it.
100 hyphen.
You have to tell which type of hyphae is it. That is what is the point there. You cannot just tell you're a postgraduate student of oral pathology. Come on.
Acetate hyphen.
What?
Acetate hyphen.
Yeah, so it belongs to
Acetate
which?
hyphen with acute branching.
So what type of?
Mucus.
Mucor. Yeah, you have to
Mucor.
tell a specific answer. It is very clear there, right? It's an aseptate hyphae with an acute branching. So most probably it is mucor species. So the structure that you see is the fungal hyphae, probably mucor. And the stain that will show this as black color is a Grocott Gomari methylamine silver stain. So I'll give you full points. 10 points for team B. Team C, name the type of stain you see in this picture. What is the pattern called as?
Immunofluorescence.
Yes, correct.
Pattern stain.
What is this pattern called as? It's got a specific name.
Fishnet pattern.
Fishnet is also fine. Any other term do you know other than fishnet? Chicken wire. Very good. Your answer is right. For the benefit of others, can you tell me in which lesion you will see this?
Pemphigus.
Yes, pemphigus. So you see the classic chicken wire or fishnet appearance in the immunofluorescence. That is a diagnostic feature of pemphigus vulgaris. Again, team C, PSM Dental College scores 10 points. Team D, name the structure marked in black arrow. In which disease is this structure seen? I'm giving you 5 more seconds. If you are not answering, it will be passed to the next team, team E. No? Okay, your time is up. Team E, do you know the answer for this?
Popcorn cells.
Very good. Seen in?
Hodgkin's lymphoma.
Correct. Do you know the specific type of Hodgkin?
Lymphocyte predominant.
Exactly. Very good. Team E, excellent answer. The structure that what you see here is a popcorn cell. You can see that the nucleus of the cell is resembling a kernel of a popcorn. That's why the name popcorn cell. This is specifically seen in the lymphocyte predominant variant of Hodgkin's lymphoma. It is considered to be a variant of a Reed-Sternberg cell. So team E will score 5 points. So we come to the end of round 4. No. I'm sorry. We have the question left for team E. I'm sorry. Identify the lesion that you see in the picture. What is the current terminology for this lesion? Team E, GDC Trivandrum.
Rhomboid gloss.
Loudly, please.
Rhomboid glossitis.
Correct, median rhomboid glossitis. What is the current terminology?
Current terminology.
Yes, what is it? You're running short of time, please.
Posterior. Median rhomboid gloss.
No, the answer is wrong. So I can give you only 5 points. It is, I'll pass the second question to team A, GDC Kottayam. Do you want to answer the second part of the question? What is the current terminology for this lesion?
Central papillary atrophy of tongue.
Yeah, it's called central papillary atrophy of tongue, also called chronic atrophic candidiasis. That is the current terminology for this lesion. Okay, so team A gets 5 points, not 5 points, 2.5, because it is a past question. So they get 2.5, team A. So this is round 4. We have come to an end. The last round will be round 5. So just a brainstorming session on syndromes of the head and neck region. So again, be ready. I'll give you only 10 seconds. You have to give instant answer. There is no pass in this particular round. Every right answer, you will score 10 marks. So be ready, team A, GDC Kottayam, Manjusha and Krishna Priya. Your question is, multiple mucosal neuromas are seen in which syndrome? Multiple papillomas of the oral cavity are seen in which syndrome? 5 marks for each question.
Multiple neuromas are seen in men
syndrome.
Yeah, you have to tell the complete answer. Complete answer.
Multiple endocrine neurofibromatosis.
multiple endocrine neoplasm.
Which type? Which type? That is important.
Type 1. Type.
Okay, next one. Multiple papillomas of the oral cavity.
Peus-Jeghers syndrome.
No. Okay, your time is up. You have only answered half of question number 1. So I can give only 2.5 marks for that. Multiple mucosal neuromas are seen in men type 2B.
Type 2B.
2B, that is multiple endocrine neoplasia type 2B. That 2B is very important. Okay. Multiple papillomas of the oral cavity have been described in a condition called focal dermal hypoplasia, which is also known as Gortz-Gorlin syndrome. In Peus-Jeghers syndrome, you only get mucosal pigmentation, specifically perioral pigmentation. You see multiple other lesions, but not papillomas. Okay. So I'll give you 2.5 for this. Team B. Multiple basal cell carcinoma along with calcification of arc cerebri is in which syndrome? Aggressive periodontitis with calcification of arc cerebri is seen in which syndrome? Team B.
Multiple basal cell carcinoma, Nevis syndrome.
You have to tell the name of the syndrome correctly. Gorlin-Gortz syndrome. Very good. Second one.
Papillon-Lefevre syndrome.
Very good. Papillon-Lefevre syndrome is the right answer. Yes. So team B, you please, you have a lot of disturbance. So make sure there is no one talking there. So team B has given the right answer for both the questions. Multiple basal cell carcinoma and calcification of the arc cerebri are important features of Gorlin-Gortz syndrome. Aggressive periodontitis along with calcification of arc cerebri is an important feature of Papillon-Lefevre syndrome. So they get 10 full points. Team C, your question is, telangiectatic spots of the face and oral cavity is seen in 2 syndromes. Can you name both these syndromes?
Ksomp syndrome.
Can you tell the complete name of the syndrome correctly?
Stuge-Weber syndrome.
No, it's wrong answer.
Osler-Weber syndrome.
Don't keep trying different answers. This is the last time I will accept that. Okay, Osler-Weber syndrome is the right answer. It is also called as hemorrhagic hereditary telangiectasia. What is the second syndrome? 5 seconds. 5 seconds. 5, 4, 3.
Ksomp syndrome.
What?
Ksomp syndrome.
No, wrong answer. The second right answer is Crest syndrome. If you remember, there is a variant of scleroderma which is called Crest syndrome. There, the letter T stands for telangiectasia. So the answer is Crest syndrome and Osler-Weber syndrome. They have given only one right answer, so they get 5 points. Team D, very simple. Macroglossia is seen in 2 syndromes. Can you name the 2 syndromes? Beckwith-Friedman and Down syndrome. Excellent. I think they got lucky and got the simplest question. Anyways, you got 10 full points. Team D, congratulations. Then we go to Team E, last question. Mucosal pigmentation with intestinal polyps is seen in which syndrome? Whereas supernumerary teeth with intestinal polyps is seen in which type of syndrome?
H-Weber syndrome.
Okay, good, correct.
Second is Gardner.
Very good. So the answer is right. Mucosal pigmentation with intestinal polyps is seen in PUSHPAGIRI syndrome, whereas supernumerary teeth and intestinal polyps noted in Gardner syndrome. So again, Team E, GDC Trivandrum also gets full 10 points. So we have come to the end of all 5 rounds. So let me just give me 2 minutes to calculate the final scores. GDC Trivandrum, Ambili and Dr. Delna, they have scored the highest points, 50 points. So they'll be the winners of this quiz. First place goes to GDC Trivandrum, Dr. Ambili and Dr. Delna. Again, for the second and third place, we have a tie between PSM Dental College and again the second GDC Trivandrum badge. They have scored equal points, 40 points. So what we'll do now is I will ask you one question. It's a tiebreaker round. So both of these teams, Team C, PSM Dental College, and Team E, GDC Trivandrum. Once you hear my question, whoever tells the answer first will be the winner. Okay? So be ready. Chromosomal translocation in Burkitt's lymphoma is seen between which 2 chromosomes?
And
Chromosome 8.
No, the time is up.
MIC
You have to understand.
MIC 24.
No, you have to understand one basic concept. Translocation will happen between 2 chromosomes. Okay, so you have to tell the
And
number of two chromosomes.
24 and 8.
No.
9 and 22. Chromosome 9 and chromosome 22.
Unfortunately, both the answers are wrong. The right answer is 8 and 14. So I have to again ask one more question. Okay, so the next question will be, the skin lesions of sarcoidosis are called as?
Eczema nodosa. No, sarcoidosis, no.
Yeah, ma'am.
Whisper no.
Don't help them, please. I can hear someone whispering. Then I'll disqualify GDC Trivandrum. I can see people whispering there.
Whisper neon. Lupus bernion.
Lupus pernio is the right answer. So the right answer is given by Dr. Sharifa and Monica from PSM Dental College. So they are getting 5 points more and they stand in second place. And GDC Trivandrum, Dr. Lakshmi and Bimal will be third place with 40 points. So thank you all so much. Thank you for making this quiz active by actively participating in that. So once again, I will announce the results of the final round of the postgraduate quiz competition organized on behalf of the Ksomp annual conference, Pushpagiri Dental College. The first place goes to GDC Trivandrum. The participants are Dr. Ambili and Dr. Delna. Congratulations, both of you. And second place goes to PSM Dental College, Dr. Monica and Dr. Sharifa. And third place goes to GDC Trivandrum again, Dr. Lakshmi and Dr. Bimal. Thank you. I would once again like to extend my heartful thanks to the entire organizing committee, organizing chairperson, organizing secretary, and the entire team of Pushpagiri for giving me this wonderful opportunity. Thank you all so much.
Thank you, Dr. Jayanti, for being the hostess of our quiz competition. I know you would have struggled like anything for the last 3 weeks. Okay, thanks a lot from the organizing team. We express our sincere gratitude and kindly receive the certificate as a token of our gratitude.
Thank you so much.
Welcome, Doctor.